Welcome to My Health Reimagined, the podcast that is not your average health podcast. I am your host, Laverne. At My Health Reimagined, we aim to build a living archive of voices that historically have been unheard, underrepresented, and underappreciated in health narratives. Our guests are invited to share their stories their way, without fear for shame or judgment. As such, our guests can make their own choices about how much of their identities they'd like to share. Joining us today are two sisters who'd like to be referred to as Sister One and Sister Two. Hello, Sister One and Sister Two. Thank you so much for joining us today at My Health Reimagined. I just want to jump right in. I just want to hear all about your stories. I can't wait to hear what you'd like to share with us today. And so, Sister One, tell me a little about yourself.
Okay, so I'm 36 years old and I'm a mix of beauty, discipline, and a little bit of just living my life and having fun. I love going to the gym, working out, and I'm into health and wellness. I wouldn't say I'm super knowledgeable, but I use social media to look it up. I know trends. Overall, I feel really strong inside and out. I'm pretty active and I'm always moving about with a purpose.
Wow, thank you for that, Sister One. It sounds like you are actively engaged in your health management strategies. That is so awesome. Okay, Sister Two, how would you describe your health management strategies?
Very similar to Sister One, I'm 36. I feel that I'm confident. I'm definitely in my grown woman era. I'm married. I have an active lifestyle. I enjoy going to the gym, working out about 5 times a week. I also go on daily walks as a stress reliever. I'm very spiritual, and I would say that my health overall is pretty well. I don't find myself getting sick too often and never have to go to the hospital. Praise God.
Both of the sisters here today indicated that they are 36 years old. So not only are they sisters, but they are twin sisters. And I'm looking right at them and I cannot tell them apart. So it appears to me that not only are they twin sisters, but they must be identical twin sisters. Am I correct?
Yes.
Wow. So, sisters, I imagine you hear this a lot. Folks tend to be fascinated with twins, especially identical twins. And speaking for myself, I'm always curious as to how deep the similarities between two twins like yourselves, how deep are those similarities? And then what, if any, are your differences?
Yeah, so physically, we often get that we look very similar. We are identical twins, so it definitely shows to outsiders, I would say. The way that people can tell us apart is from personality. We're completely different. We spend a lot of time together. We talk about each other a lot because we are in each other's lives very significantly, but yeah, physically, definitely hard to tell us apart.
Okay, that was Sister Two. Sister One, did you want to add anything? Or
Yeah, I would say probably, I think with identical twins, genetically, you're very similar, almost down to your fingerprints being almost exactly the same. In fact, we can unlock each other's iPhones with our
amazing. I
faces.
did not know that.
However, I'm slightly taller. Sister two is slightly weighs a little bit more. So we can tell, like, environmentally, we're different.
Thank you for that, Sister One. I think that's a very interesting point, a very important point to come back to, because you're telling me that you believe that even though genetically you're very similar, in fact, you say all the way down to your fingerprints, you also believe that your environment, your social environment, your natural environment, can allow for some exposures that impact your health. And I think that's so important that we talk about that a little bit more. And so I want to get back to that. But first, I'd like to play a rapid fire question and answer game. I'd like to know just how similar and just how different you really are. So if you don't mind playing along with me, I'm going to ask you a few questions, and I'd just like you to just give me the first thought, the first answer that comes to your mind. Okay?
Yeah.
So Sister one and sister two, if you could be any animal, which animal would it be and why? Sister one, you first.
Probably a puppy because it's just like the animal that I love the most.
Okay, so I saw some looks there. Sister two, are you going to say the same thing?
I was going to say a puppy as well because they're so cute and I love puppies.
Okay, so right there, I think you are too. Very similar. How about this question here? If you could switch lives with any fictional character, sister one, who would that be?
Oh, that's a hard question.
You're pretty content with your life as it is, huh?
Yes, I am.
So no fictional character out there that you're like,
no.
All right, how about you, sister two?
I thought that was a hard question as well. So I think I'm content.
All right, let's try another question. What's something that everybody else dislikes but you love? Or vice versa. What's something that you love but everybody else dislikes? Let's start with sister two this time.
Candy corn.
Candy corn. You love it or what?
I love candy corn.
Okay.
I'm obsessed with candy corn. That's just for you because it's gross.
Okay. All right. So finally, some differences here. Okay. So sister one, you do not like candy corn.
No.
And sister two loves it.
Yes.
All right. How about you, sister one?
I guess going with like a food item, I love like soda and seltzer waters, like the plain ones.
And yeah, that's kind of acquired taste too. How about you, sister two? You like that too?
If I'm at her house and it's the only thing to drink, I drink it.
You're drinking,
but
it's
I don't buy it. No.
Okay, so then now we're pulling out the differences then. So deep down biologically, there are some differences. You have different taste buds. At least we know that much, right?
Yes.
Okay, good. Let's unpack those biological differences a little deeper here. Let's just start with how you rate your health. Sister one and sister two, can you tell me on a scale of 1 to 10 whether you rate your health as a 1, meaning I have poor health, as a 5, meaning I'm surviving, I'm getting by, or as a 10, meaning I'm thriving? How do you, sister one and sister two, rate your health?
I would say probably like for sister one, it's at 8.5 out of 10.
8.5 out of 10?
I rarely ever get sick. And for the most part, I visit the doctors like for, like your routine physicals every year with a clean bill of health.
Interesting. And so you rarely get sick. When you go to the doctor, you have a clean bill of health, but you would not have given yourself a thriving score. Why is that?
I don't give myself a 10 because I don't ask questions. I get like the standard blood work. I don't get anything advanced looked at or looked into because I don't necessarily feel like I have to.
So do you think that if you did additional blood work that there would be problems?
Possibly.
What makes you feel that?
Because I never looked into it.
Interesting. Okay, how about you, sister two? Rate your health on a scale of 1 to 10, where 1 is you don't feel very good, you think you have poor health. 5 is you're surviving, you're getting by. 10 is you're thriving. How would you rate your health?
I will rate my health a 5 out of 10. And it's not because I feel as though I'm unwell. It's that I feel as though there's a lot of preconceived notions when I visit the doctor and they've already seen my sister. We share the same physicians across the board, from our primary care practitioner to our gynecologist. And so a lot of times they will say, "Oh, I've just seen your sister." And are you experiencing the same issues?
So, what I'm hearing is that you feel fine personally, but you have this inkling that the doctors wouldn't necessarily say that you're thriving. Am I really saying it correctly?
A little, but I think what they feel as though if my sister came in and her test results showed normal, then mine would necessarily show normal. Like Sister once said, there would be no additional need for more blood work, more tests, more questions. They're assuming if Sister one's test looked normal and healthy, then Sister two, you're probably fine and they don't need to spend as much time with me or spend as much time asking questions. Or it could be the complete opposite. If sisters one tests are within normal range, sisters two tests are maybe a little different, then all of a sudden it's spiraling and something's wrong with sister two. But that may not be the case if it was individually looked at. Assessed, correct. Assessed.
So, have you ever spoken to this with your physicians? Have you ever tried to suggest that they look at you as individuals?
I feel that when we start having the conversation on family history with our medical doctors, they look at twins as being really scientifically fascinating. So just having those first initial conversations, it starts going down different rabbit holes for genetics versus environment conversations. What are you experiencing versus your sister? And we get it. We get it's interesting. But sometimes that curiosity of being twins with the doctors, it really overshadows the fact that we're two separate people coming in for two maybe different issues or problems with our bodies and our needs. So instead of the doctors focusing on being twins and having more history on what we've gone through together, we would like them to treat us as individual patients first and talk to us about our own concerns before diving into the twin history. Yeah, and just to elaborate that a little bit on that a little bit more so recently I started looking into my fertility health. And when I went to my specialist, we were going over the history and I mentioned I have an identical twin sister because a part of the questionnaire is telling about your siblings and their ability to conceive children. And so I went into I have a twin sister and she immediately the practitioner became super excited and was like, okay, well, what are her problems? My sister one has not even signed up to come here. She hasn't even had an appointment, but you're asking so many questions about her, and your excitement and your engagement in the identical twin factor felt like it took away from my initial appointment to the point that the specialist then went to say, well, if your sister's looking for a specialist in this area, I have availability. Well, the conversation should have never gone that deep into what was happening with my sister. And when I tried to navigate it back to me, it seemed as though her interests lied in the fact that we were twins experiencing very similar situations at that period of time.
Interesting. So, would it be fair to say that you felt unheard?
Yes, that would be very fair to say.
And Sister One, have you experienced the same feeling of not being fully heard when you're trying to navigate your health journey?
I would say yes, definitely. Um, and it's been that way since actually our birth because when we were born, sister two had a hole in her heart. Well, when our parents were discussing the situation with the doctor said, well, if sister two has a hole in her heart, then sister one must have a hole in her heart. And our parents were like, no, the cardiologist did not say both babies had a hole in their heart. However, the doctor that was going to perform the surgery was convinced that because we were identical twins that it had to be the same situation, and they wanted to run more tests on me versus my sister just to double check. um and so our parents, their case wasn't heard about not doing all the testing on both babies because only one had the condition. So of course they went through with both testing, and I did not have a hole in my heart.
Hmm.
Sister two did, and thankfully it healed naturally without surgery. But the doctors were very insistent that they test both babies.
Hmm. And how do you think the outcomes could have been different if you had been heard, if your parents had been heard, if you had been heard when talking to your fertility specialist? How do you think the outcome would have been?
Well, I think the outcome one, I think sometimes it discourages the patients or the parents from really understanding their individual health, because sometimes now that I know of the doctors, the way that they are looking at my sister and I's health, sometimes I go in there and I say, "Oh, well, this is the situation with my sister. I think that and she's been diagnosed. I think that I have the same situation, but I should go in there knowing and confident in speaking as a individual." And I think it takes some of your power away, knowing that the doctor is automatically going to relate back to your family's history to diagnose you. Not that it's the wrong thing to do, because we know history is very important and our genetics make up who we are, but it should not be used as the only guiding factor of your health. And I think individually knowing for yourself and being able to speak for yourself changes the way that you're able to advocate.
Yes, I agree. Thank you so much, Sister Two, for sharing that. Sister One, did you have anything else to add?
Yeah. When I go to the doctors, I'm here to talk about my body, my concerns, not my sister's. If she wanted to talk about those things, she would be here doing it, not me. So I think when I'm at the doctor's, it really concerns me when they make assumptions based off of my sister, because what happens, they misdiagnose me, or they miss a concern, or they miss a test because they want to jump and say, well, this is what I prescribed to your sister, or this is what I did for your sister, and I'm going to do the exact same thing for you because you guys are twins. I think if they would look at us as individual cases, maybe the prognosis or the diagnosis and how to treat it would look different.
Exactly. And you've already given me one example where you said one sister had a hole in her heart and the other sister didn't. As adults, have there been other examples where your diagnoses were very different, but you had to really fight to have more control over your health journey and your health management?
Well, what I think is interesting is sometimes when we do visit the same physician and they do treat us as individual cases, we will compare how the doctor treated us, what they gave us, and things in that nature for the same issue. And sometimes we see that maybe one sister felt as though the doctor was dismissive, rushed them off, and gave them a very
Mm.
generic treatment, while the other may have received something specialized and they got a different prescription and they felt different, maybe better, maybe worse, or whatever the case may be. So sometimes it's not even that the the treatment and the diagnosis are similar, is that they're completely opposite. So how does that work? Why is it different when our results from our lab work are the same?
You have a very unique perspective that most people don't have and they can't really put their finger on it. But I imagine that there are a lot of folks out there that feel like, I was brushed off. The physician didn't really hear me. I didn't get the right treatment that I should have gotten. And I believe that if I were someone else, I may have gotten a different treatment. And you, being sisters and twin sisters nonetheless, are able to actually compare and actually see for yourself with real proof that that's what's happening. Did you have anything else to add, or where you believe things could have been different if you could have participated more fully in your health journey?
Well, I guess in a sense, if I had to reimagine my health and what it would look like having these conversations, it's one, being able to approach my care as an individual. And even though I share the same genetics as my sister, it would be more so understanding from the healthcare provider's perspective, what parts of twin health should be considered clinically relevant and what parts are just a part of the experiment or a part of just knowing the history of a person. I do think that genetics play, like I said before, a very important aspect of how doctors are able to diagnose us, but I also want to know what percentage of that history plays a part. And then also being able to just understand from the perspective of healthcare providers, how can you use your family history to advocate?
Mm-hmm.
So, at certain parts of in our lives, we know that our families have gone through different situations that may play an important and critical factor of how we care for our own bodies and understanding what part of that should we bring up to a professional.
Mm-hmm. Let me just ask you one question that I know is going to be a burning question for our listeners out there. Have you ever considered different doctors? The both of you as twins not sharing the same doctor. Do you think that would have helped?
Mhm. That is a good question. For me, no, because I go for my doctors personally, I go based off of family and friend recommendations. So all of my doctors in my vicinity are from recommendations, and I feel very comfortable with them.
Okay, thank you. And Sister One, if you had to reimagine your health journey, what would come to mind?
Um, it will be very similar to Sister Two. My health reimagined would be how I communicate with my providers. Sometimes it feels awkward to say, I have a twin sister. She has these similar symptoms. However, I don't want you to consider those when diagnosing me. I would like you to treat us individually. Um, and sometimes that does feel uncomfortable because I want to share with them what's going on with my sister because I know genetics um play a part in health. However, I don't want that to be a factor in how I'm treated.
Thank you, sisters. I truly appreciate you joining us today and sharing your stories and helping us to reimagine a health system that works better for all of us. Remember, at My Health Reimagined, we are rewriting health narratives, one unheard story, one underappreciated perspective, and one conversation at a time. So if you have any questions or comments, or even similar experiences that you'd like to share, then join us at myhealthreimagined.org. And together, let's keep the conversations going.